This white cartilage that's on the end of the bone, it's a really hard, smooth cartilage. It's called articular cartilage. This is actually what it looks like arthroscopically when I'm looking in there. And when the cartilage becomes damaged, we grade that from 1 to 4. And grade 1 means that it's just a little bit on the soft side. And that can happen even at a relatively young age where there may be some softening of the cartilage. And those are the people that are kind of predisposed later on in life to developing arthritis, because over time the softening can turn into a little tear. And here's an example of a little flap of cartilage that's torn, and this will catch in the joint, and it can cause very similar symptoms of catching and locking and giving way, and that can cause pain. Here's another example of some cartilage. This is behind somebody's kneecap, and here you see it kind of hanging down here. It looks like crab meat almost, and I can't replace the cartilage arthroscopically, but I can smooth it out and make it soft again and smooth again. And so the advantage here is that those little edges that were hanging down are not going to catch in the joint anymore, and hopefully will help with pain. Here's a case where the cartilage is worn all the way down to bone. This is the tan-colored area here that's worn down to bone. Now this is a unique situation because the cartilage around it is relatively normal. And this is important because when we have this type of situation, we can do procedures that can transplant cartilage into these defects. We have a variety of different ways of doing that to get cartilage to grow back in here. But it's only possible because the surrounding cartilage is relatively normal, and it's what we call a contained defect. So it's contained really well, and so we can plug cartilage in there or get cartilage to grow back in there. But again, this is only possible when it's a contained defect as opposed to a knee that has arthritis all over it and it doesn't really have very good contained areas. Then we can't patch up the entire knee with a lot of plugs. That wouldn't really work very well. So that's when it really results in arthritis, when a lot of the cartilage is worn down diffusely.